Hi, everyone, and thank you for joining us today for a very special webinar. Today is the last webinar in the American Association of Community Dental Programs series, and we are delighted to have you here, and we have an outstanding team. My name is Katie Conklin, and I'll be today's organizer, and it is my honor and my privilege to introduce Dr. Bahar today.
Thank you so much, Katie. It's my honor to be the moderator of this last webinar as well. We have been together for the last month and a half through this webinar series for AACDP. And today we are gonna talk about updates, awards, and hot topics. This is a very special day for us because we will get a chance to honor some of our heroes in the field of dental public health. And given what is going on in our community, we really appreciate that to be able to be with all of you and celebrate the awardees. Next slide, please. So I will be the moderator as well as Lynn Short, who is going to join us later for the presentations. And our organizer, Katie Conklin, has been behind the scene and working really hard to make this happen. Next slide, please. We want to thank our sponsors, California Department of Public Health, CDA, ADEC, Dental Quest, as well as ADA. Next slide, please. Some housekeeping tips. So if the entire meeting drops, don't worry, check your emails. There's going to be some instructions of what to do. The webinar slides and videos are available on AACDP website. The videos are going to come afterwards, but the slides are right now available there if you want to upload them and have them with you. And in order to receive CE units, make sure that you complete the evaluation at the end of this webinar. The links will be sent right after, so make sure you do that within the next week so that we can complete the CE process. Next slide, please. If you have any questions, please put them in the QA box. The chat makes it a little harder, so Q&A is better for the questions answers. We try to answer as many questions as we can at the end, and if not, we'll make sure that we put a list together and we'll send you the answers so everybody will have that afterwards. Next slide, please. And our objectives of today is really to honor the contribution of dental public health awardees and also learn about some hot topics for today as well. That includes ADA, culture of safety, educational resources, and water fluoridation. Next slide, please. Great, so with that, here's our agenda. And we would start with our award ceremony. Next slide, please. At this point, I would like to hand it to Dr. Larry Hill. Dr. Larry Hill is the Executive Director for AACDP, which stands for American Associations of Community Dental Programs. Dr. Larry Hill will give us an overview of these awards and their history, and then we will introduce our awardees and we will celebrate them. Thank you so much. Larry, Dr. Hill, will you please join me here? Now we're going to bring your video on. Sometimes it takes a moment for that video on to go on. Fantastic, great. And if you could please unmute yourself. Fantastic. Dr. Hill.
Okay. Yeah, thank you. And thanks everybody for attending. This has been a long journey, both in the original planning for the meeting and then changing to the virtual format. So I want to thank all of you for hanging in, for being patient, and for being with us. My job right now is to tell you a little bit about the awards. Back in, in some of the early days of AACDP, we recognized that there were a lot of folks out there working at the community level who were doing great things. In fact, an awful lot of the achievements in dental public health over the years have started at the community level. Dental public health is not just a top-down, but a bottom-up kind of organization. And we felt that it was really necessary to, and fitting that we would recognize some of the folks, and it's I wish we could recognize so many more folks every year than what we do, but there are so many people out there who have done so much and committed their careers to the oral health of their communities, that we wanted to recognize them, and we also wanted them to be recognized by the broader dental public health audience. So back in 2004, we established the American Association for Community Dental Programs Lifetime Achievement Award. It was an award for outstanding contributions in community dental programs, and was first awarded to Dr. Myron Allukian, who was then the dental director for the city of Boston. He had just retired, and we wanted to honor his outstanding contributions to oral health at the local, state, and national levels. Myron had an outstanding career and is on the phone with us today, and his most recent outstanding achievement is surviving the COVID virus. So not only are we glad to have Myron with us today, we're glad to have Myron with us. So that was in 2004 when that award was first established. 10 years later, we established the John P. Rossetti Community Oral Health Impact Award. The award was established, again, to recognize not necessarily a lifetime, although it might be a lifetime, but to recognize a significant contribution by someone that is not necessarily a dental professional, but could be, and but someone who's had a significant impact on oral health at the local, state, or national level, and is presented to an individual who's demonstrated outstanding service, commitment, and leadership to improve oral health, especially to the underserved. And this year, so we have those two awards to present, and this year, you know, I want to mention that it's interesting because the meeting was slated to be in San Diego, and totally by coincidence, not by plan, but totally by coincidence. We have an awards committee that's not by coincidence. We have an awards committee that Myron actually chairs, and other members of the committee this year were Alice Horwich, Jay Balzer, and myself. And by coincidence, the awardees this year are all California folks. And in reviewing the nominations, we also felt that there was a call this year to have a special award, a Community Hero Award, for a very significant contribution to the oral health of a region, maybe of a state. So with that, that kind of sums up the general description of the awards, and I will now turn it over back to Bahar. Is that right?
Yes.
Okay.
That's right. Thank you so much, Larry. It was amazing to just get a little bit of the history. And with that, I would like to introduce Dr. Jared Fine to present our first award, Myron Allukian Junior Lifetime Achievement Award, and our awardee, Dr. Huong Le. Dr. Fine.
Thank you, Bahar, and thank you, Larry. Dr. Le's remarkable career of over 30 years began as the dental director for 2 federally qualified health centers, and truly took root when she became the inaugural chief dental officer for Asian Health Services in Oakland. At the local level, her visionary and innovative leadership has fueled her ability to increase access to integrated healthcare to over 27,000 patients per year, speaking 11 languages, with a staff of 70 at 3 clinic sites and 3 school-based sites. One site at the community college level, assisting program, uniquely combines comprehensive dental care for low-income residents and students with a powerful learning opportunity for career ladder workforce development. At one school-based site, she demonstrated both comprehensive care and financial sustainability, thus paving the way for 8 additional federally qualified health centers to receive funding and replicate the model. As a teaching facility, under her direction, Asian Health Services trains over 30 dental students and residents each year. Dr. Lay recently pioneered the opening of the first standalone dental and wellness center, combining professional screening for depression and behavioral health issues, now recognized nationally by the Assistant Surgeon General as a best practice. In 2019, she initiated another innovative integrated care model, routinely testing for hemoglobin A1C for dental patients in the dental clinic. The funding for the diabetes screening and control program came from the sugar-sweetened beverage tax in Oakland, in which Dr. Lay was a leader in the battle to enact that tax, especially within the Asian community. That very same sugar-sweetened beverage tax in Oakland now generates $11 million annually for prevention and or mitigation of diabetes, obesity, and dental caries. Beyond her extraordinary and collaborative efforts at the community level, Dr. Lay is a recognized leader among her professional colleagues, both at the state and the nation. She was the first Vietnamese American to serve on the Dental Board of California, serving for 11 years and as its president. Recognized for her clinical excellence and knowledge of the federally qualified health center environment, she is called upon throughout the state and the nation on her technical expertise. Most notably, as the president of the National Network for Oral Health Access, she championed the evaluation of and transition to electronic health records. She was chosen by the California Dental Association to the powerful Committee on Workforce Development, charged with the critical policy recommendations shaping the nationally recognized and fully realized California Dental Association plan in overcoming barriers in access to care. Speaking of innovation, just 2 weeks ago, seeing the drive through the COVID testing for the medical clinic and aware of the request from parents for kindergarten dental screening, which is a California requirement, she pilot tested drive-through screening and fluoride varnish applications while the kids are in the car while wearing full PPE. Her staff made mention of the fact that when it was an SUV, she needed to stand on a chair. And last night at the Alameda County Dental Society, she was nominated and accepted the position as ethics chair for the Alameda County Dental Society. Against great odds, in 1975, Dr. Lay, a teenager, and her family boarded the last boat that barely escaped the chaos unfolding in war-ravaged Saigon. It has been with the same courage and vision that has defined Dr. Huong Lay's passion and commitment to creating a brighter future for those less fortunate. The American Association of Community Dental Programs is very pleased, and I am personally very pleased to present her with the 2020 Myron Allukian Jr. Lifetime Achievement Award for her outstanding service. Dr. Lay.
Okay, so this is what I received from the American Association of Community Dental Program. Thank you so much. Good morning to my West Coast colleagues. Good afternoon to my East Coast friends. And good afternoon to Dr. Myron Allukian. Thank you so much for joining us today. I first would like to thank the Board of Directors of American Association of Community Dental Program for this amazing recognition. Thank you, Dr. Jared Fine, for such a heartwarming introduction. Thank you, Dr. Larry Hill, and again, Dr. Myron Allukian, for the wonderful opportunity to be recognized before this group of leaders in the country, in the dental profession. This award has a special meaning to me. Yes, 45 years ago, I came to this country with just the clothes on my back. My parents and their 8 children in tow. I hardly knew the language at the time. Fast forward today, I consider myself to be the most fortunate dental professional in that I get to do what I love, serving the underserved in my community. Like all of you, I did not go into this work for the money, for recognition. I know we do the job because we love our dental profession. We have a true compassion for our community's patients and humankind. Every day I come to work with hope that I can improve the lives of the people I touch. So to me, it is love, not work. So to be able to do what I love and to be recognized for it, it just makes this award so much sweeter, more rewarding, and more meaningful. Things happen for a reason, I always believe. 45 years ago, my family lost everything. 2 months ago, I could have lost my dental program due to COVID. The virus hit us like a tornado. Things turned chaotic. Overnight, we did not know what to do. We panicked. We felt lost. But we decided to stay and fight. Because we have a community to take care of. We had to learn how to do dentistry all over again, how to stay connected with our patients and community. Overnight, we had to learn the new method of providing care called telehealth. Through telehealth, we were able to diagnose primary herpes on a 7-year-old patient, a median Palatine cyst on another. We helped so many patients throughout this time when we were told we could not see the patients. We implemented a drive-through for Advantage program that Dr. Jared Fine mentioned earlier for our young patients so that they can receive their oral health needs assessment for kindergarten enrollment. My staff, my providers were so happy when we started that program. After so many weeks being cooped up in the office, sitting in front of the computer, doing telehealth, it was so nice to be outside, just breathing the fresh air, and get to see those smiling faces, of the children, sitting in their car, buckled in their car seats. It's just a fun thing to do. And that's why we love doing what we're doing. I believe that the practice of dentistry has changed forever now. I think it's very scary, but also very exciting. I know a lot of work has gone into making this possible, and I want to thank Dr. Bahar and her team, Katie, and a lot more people that put so much work behind the scene. Again, in conclusion, please accept my humble gratitude for this tremendous recognition and amazing experience from the bottom of my heart. Myron, please get better soon. Get out of there and come back to join us. I don't know about you guys, but every day I pray that this pandemic will go away soon and that every life that has been affected by it will eventually heal. So have a great day, everyone. Stay safe and healthy. I love you all. Thank you.
Thank you so much, Dr. Lay. Such an honor to have been working with you throughout the years, and such an honor to be here to be part of this award ceremony. The heroes like you that make this work. Thank you so much. We appreciate you. And with that, we are going to go to our second award. I would like to bring Dr. J. Kumar on the floor to introduce the awardee for John Rossetti Impact Award, Ms. Gayle Mathe. Dr. Kumar.
Thank you, Bahar. Thank you, AACDP, for organizing this webinar. It's with great pleasure that I present this year's John P. Rossetti Community Oral Health Impact Award to Ms. Gayle Mathe for commitment and dedication to improve oral health. Ms. Mathe is the Community Health Policy and Programs Director for the California Dental Association. Ms. Mathe has worked on various aspects of oral health care policy, education, and legislation for nearly 20 years. Prior to her work on policy, she worked as a registered dental hygienist for 2 decades. Throughout California, Ms. Mathe has successfully worked to ensure residents enjoy the health benefits of fluoridated water. Over the years, she has worked on a number of projects, including the establishment of state dental director's position, state oral health plan, kindergarten oral health assessment, new standards for pediatric dental anesthesia, advocacy for increased reimbursement rates for medical dental services, establishment of the virtual dental home, development of a guide for caries management by risk assessment, establishment of pediatric and geriatric oral health access program, and promotion of registered dental hygienists in alternative practice, and of course, more recently on COVID. Our leadership in consensus building by finding common ground is illustrated in the development of the California Dental Association strategic plan. Ms. Mathe has demonstrated innovative thinking in bringing policy and practices to the community. A fine example is the implementation of the Proposition 56 California Tobacco Tax Act, which provides millions of dollars to dental programs throughout the state. Her notable service at the local, state, and national level to improve the health of the California is unparalleled. Ms. Mathe was instrumental in implementing the 2007 statewide kindergarten oral health assessment requirement in California. She has championed to shift the management of early childhood caries from surgical management to a more prevention-oriented approach. Ms. Mathe developed a training program called TIPE to provide free continuing education to dentists who are interested in managing early childhood caries. Over the years, she has served as a convener of several regular work group meetings. These work groups serve as a forum to many organizations to discuss prevention and access-related issues. Ms. Mathe has facilitated the reporting of these work group products as publications in the California Dental Journal, covering various issues from antibiotic stewardship to access to care for elderly to smoking cessation and many, many issues. At the state level, at the national level, Ms. Mathe served as a member of the Institute of Medicine Planning Committee on the 2018 Oral Health Literacy Workshop. In the last 3 months, she has worked tirelessly to provide practice support to dentists on COVID. Ms. Mathe's extraordinary work has catapulted California's dental public health from, this is how Dr. Jared Fine wants to say, one languishing on life support to decades to the most vibrant and best resourced dental public health program in the nation. A hallmark of her work is the unwavering commitment to improve the oral health of the public, especially underserved population groups, without clamoring for recognition or publicity. So therefore, she's well deserving of this award. So your award is in the mail, Gayle. Thank you.
Gayle, the floor is yours.
Thank you. Thank you so much, Dr. Kumar. My prepared comments are going to emphasize how much all of that occurred with such a large group of people. So let me begin by again thanking everyone. And Dr. Allukian, it's wonderful to hear your voice earlier today. I'm so glad you're able to join. I'm honored, excited, and humbled to be recognized by the AACDP. And frankly, I'm honored, excited, and humbled to have worked for so many years with so many of you on the various projects that Dr. Kumar just talked about that have brought us all to where we are right now. You know, I did have a long clinical career. You guys nicely cut those years short, make me younger than I actually am. That career in clinical dental hygiene took me from Southern California, where I grew up and went to school, to Northern California, across the country to Boston, back to Southern California, where I spent time working in dental offices in Hollywood and Beverly Hills. And yes, it was actually as fun and exciting and full of surprises as it sounds. Ended up back in Northern California and eventually joined the policy and advocacy team at CDA in 2003. If you wondered about that jump, like what brings a hygienist to policy and advocacy, it really was not a straight line. During all of the time that I practiced as a hygienist, I also worked on a number of interesting community advocacy projects, including help founding a preschool in the Los Feliz area of Los Angeles. For anyone who's interested in that and wants to look it up, it's All Children Great and Small. I led a successful school bond campaign in Folsom, Cordova, after being a volunteer on 2 failed attempts. And then I also worked on outdoor tobacco policy that established a smoke-free California State Fair. So those various projects brought me to the point of joining CDA in 2003. My 17 years there have allowed me to work closely with so many dedicated and creative individuals, looking for and identifying opportunities and working towards solutions to improve oral health. And Dr. Kumar talked a lot about those. I've been blessed by the teamwork, innovation, and unwavering commitment to stay the course from people, but also institutions. You know, CDA has been behind me and our work 100% of the time, including some incredible bosses like Liz Snow, Kathy Mudge, Carrie Gordon. Those are names some of you may recognize. And visionary leaders too numerous to mention. Certainly CDA's Executive Director, Peter Dubois, but also 2 of this morning's presenters. So Dr. Jared Fine, Dr. Fine, we go back forever. Thank you so much for your partnership over the years. So many of the projects that Dr. Kumar talked about are projects that we spent hours, you know, working on and talking together. And Dr. Kumar, more recently, you've been an amazing partner in the things that we're doing in California. So the inspiring group of individuals that are doing this work inspires me and energizes me. California's oral health programs and our dental public health infrastructure have never been stronger. And certainly COVID-19 is challenging that. I think we will have a bumpy road ahead. But what's been accomplished has occurred through commitment and dedication and successful partnerships with so many advocates and allies. And what I'm moved by and inspired by, and thank you, Dr. Lay, for your comments, which were incredibly inspiring. Knowing that we do more together than any one of us can do alone is my living experience and truly fills me with joy. Thank you, everyone. Be well, stay safe.
Thank you so much, Gayle. It has been an honor to have been working with you and being part of this ceremony. And you're right, we all can do much more together than any of us alone. And with that, I would like to introduce our Community Hero Award and bring on Dr. Howard Pollack to bring the award to Miss Ellie Nadler. Dr. Pollack. Yes.
Thank you, Bahar, and thanks to AACDP for CDP for putting this program together. It falls upon me to have this distinct honor and pleasure to introduce Ellie Nadler, RDH, BS, MPH, for the Community Hero Award, apparently an inaugural award, by the American Association of Community Dental Programs. I've known Ellie Nadler since 1995, the year in which California enacted its fluoridation law. I served at that time as the vice chair of the California Fluoridation Task Force. Ms. Nadler, as the executive director of the San Diego Fluoridation Coalition, joined the task force's steering committee in 1997 and stayed the course for many years. Her leadership was vital in marshaling support for fluoridation in the city and county of San Diego, culminating in the fluoridation of the water system of the Metropolitan Water District of Southern California, the largest water system in the United States. Additionally, 13 water districts in San Diego County are now fluoridated, including, of course, the city of San Diego, which at the time had the dubious distinction of being the largest city in the United States that was unfluoridated. Most people in the county of San Diego now have access to healthy and safe fluoridated water. Ellie has been the leader in the forefront of fluoridation promotion in her county, sought after by the media, in addition to serving in leadership roles, including serving as president in the San Diego County Dental Hygienists Society. She's been recognized for her leadership by the San Diego County Dental Association, the California Dental Association, and the American Dental Hygienists Association. All these activities occurred while she maintained her dental hygiene clinical practice. It should be noted that after some 34 years as a dental hygienist, she pursued a Bachelor of Science degree and a Master of Public Health. These accomplishments enabled her to take on leadership positions in dental hygiene and in the promotion of community water fluoridation, which became her passion. I think it's fair to say that without Ellie Nadler's passion and leadership and persuasive communication skills, the fluoridation of the many water districts in her local San Diego City and County may not have occurred. I'm glad to say that even in retirement in Northern California, Ellie remains actively involved in fluoridation promotion, and she continues to be vitally important, as there are challenges of different kinds facing some of these fluoridated communities even now. Ellie was a rising star when she was studying dental hygiene at Northwestern University School of Dentistry, where she was elected to membership in the Sigma Phi Alpha Dental Hygiene Honorary Society. And now, some 64 years later, she is being honored once again. It's my great pleasure to introduce my good friend, Ellie Nadler, RDH, BS, MPH, as the American Association of Community Dental Programs 2020 Community Hero.
If you could unmute yourself, Ms. Nadler, please. Okay, you're ready to go. Thank you.
Thank you, Howard. That was very exciting to listen to. I don't know who you were talking about, but this also arrived, and such a pleasure and a treasure to have this. Thank you all so very, very much. It's beautiful, and it's exciting to be here among all of you. I wanted really to just thank the association so much for all the work that you do, everything that has involved fluoridation, the foundation of everything else that we do in community programs. It's been a pleasure. And very exciting to have you, Dr. Allukian and Myron, on this program with us. That was a really big surprise to me this morning. We owe you such deep appreciation for coming to San Diego, and that, as Howard said, was circa 1995, to evaluate our chances at the time of doing what seemed to be the impossible, a renewal of San Diego's water fluoridation system. You helped the entire statewide project, not just San Diego. You helped us write a great story, and it's a story of community effort and success, the all-important word. This is our story. About the hero part of this award, in the title for the award anyway, well, perhaps we have to consider what that word has come to mean in the last 2 months of the world. And we know it means taking action, even if your life might be in danger, in jeopardy. Well, only once was I made aware of a threat to my life while I was doing this work. When a member of my own area's city council decided to call me and assure me that I was going to die if I chose to take a bath in a tub because the water was now fluoridated. The expanded description that we have of this award is more to the point. community and team effort, just as others are talking about. And those are the essentials for getting anything accomplished in community oral health. We don't do it on our own. We know that, and certainly not at this level and this magnitude. We're indebted to all those far-sighted leaders who worked on this statewide needs assessment. Remember neglected epidemic? I consider this the start. This was the starter for writing the script that we're talking about here today and thinking about right now. I'm thinking of temporarily changing the name of the organization to make this, at least for the moment, the American Academy of Community Dental Programs. And as the Academy's award recipient, then I get to share the stage with some of the directors, and I can call them up to this stage right now. And so come on up here, Dental Health Foundation, and CDA and CDHA, and Howard Pollack, Ernie Newbrin, Tim Collins, Dave Nelson, Jared Fine, and Marjorie Stocks, who made everything work, and she still does. And of course, there are so many others, but you don't have time to hear all their names. The producers were a little more difficult to come by, but we did. Everybody did, especially the 5-star first 5 and Ron Roberts. We can never forget. California Endowment, Wellness, California Wellness Foundation, United Way and Children's Initiative, so important in San Diego, CDAP and John Roth, San Diego Dental Society and its foundation, Parker and Alliance Healthcare Foundations. They all made the work in San Diego possible. And there was a cast of hundreds. I hear that music wanting to usher me off the stage, but let me just try to really run through quickly a bunch of names. But they're so special, every one of them. Kay Stuckart, Dick Hancock, Susan Lovelace, Mike Coons, Bob Hanlon, Harriet Selden, Lester Machado, Marilyn Jacobson, Bev Hom, Philip Zold, Ed Martinez, David Barron, Barb Caves, Nick Sulus, Nancy Starr, Peggy Yamagata, Dave Schubert, and always at my right hand, RDHAP extraordinaire Gayle Gilman. And we can never forget the ones that we lost. Stan Foster, Dr. Ellie Schneor, and Joan Christensen. Well, today when budget cuts and orders are going to be the new reality, I fear fluoridation is going to be an easy target. So we all have to become very politically active, astute, and involved now. For me, for this, for us, this is the big prize. I hope you can see this, because to me, it's one of the most beautiful things in my life. We fought for this, we all share it. The pink that you saw was optimal water fluoridation throughout San Diego County. And when it began, that page was completely blank. My father taught me early in life, the impossible just takes a little longer, and it sure did. Thank you all on behalf of myself and the entire San Diego Fluoridation Coalition. Thank you.
Thank you so much, Ellie. There's such an amazing work. That the picture of that map with the pink areas is going to stay with me for the rest of my career. And with that, we would like to bring on our 4th award, which is an additional award for this year. This award, if we can go to the next slide, please, Katie. This is called Myron Told Me to Do So award. And I will bring Dr. Jared Fine to the floor to present our awardee, Dr. Larry Hill. Dr. Fine.
It's a pleasure to announce and present a special and unique award to a special and unique person to honor him for his dedicated and immeasurable, outstanding and sterling service to the American Association of Community Dental Programs. The Myron Told Me to Do It Award, or the Myron Tells Me to Do It Award, as he did again this morning, is presented to Dr. Larry Hill. Without question, his work to assure the viability of the association has served to educate and inspire local dental public health workers in their challenging efforts on behalf of the millions throughout the nation whom they serve. We are deeply indebted to him, and in recognition of that service, present him with an inscribed Cincinnati Louisville Slugger bat to commemorate his amazing and selfless service, even though he thought he was going batty at times. And here it is. Larry, we're very happy that you have been serving the association, even though at times you thought you were going batty. We love you and we appreciate you.
Let's see. Am I on?
You're on, Dr. Hill, yes.
Okay. Well, Jared, I want to thank you so much for that. I don't know if here is the bat, and thanks for passing that over 3,000 miles, Jared. I appreciate that so much. This is you know, an unexpected honor, and I want to say that I'm just so proud of working with the folks across the country that I've had the pleasure to work with over the last I guess 30, 40 years. I just, you know, the Association for Community Programs had its very initial beginning at a meeting of the National Fluoridation. It was the annual meeting of it was National Fluoridation meeting sponsored by CDC back in the late 70s and early 80s. And Mike Easley, who was the state dental director in Ohio at the time, asked me to come to that meeting. And I said, well, it's for state dental directors. And he was saying, well, yeah, you can come anyway. And what I found at that time was that state dental directors had a relationship with folks at the federal level and talked to them, and the feds talked to the folks at the state level. Nobody talked to people at the local level. The folks that were working at the grassroots, who probably understood the most the needs of the community, what was, you know, the obstacles that they came up against when they were trying to get dental care. And nobody seemed to really care or recognize what the folks at the local level were doing or had to say or had to contribute. And so that was at a meeting at this National Fluoridation meeting, which eventually became the Association of State and Territorial Dental Directors meeting, which eventually then joined with the Association of Public Health Dentistry to make the National Oral Health Conference. But back in those early days, again, local folks weren't particularly welcome. And so in '81, we started saying, well, maybe something should happen. Maybe we need to have a voice. And between 1981 and 1983, we did some formative kinds of things. And we received the 501c3 in 1983. And from that time, I think we've worked to maintain a visibility and a voice in public policy. We've been represented on Healthy People 2010, 2020, the development of the Healthy People Oral Health Objectives. We've been a part of Head Start committees and advisory committees. We've been in a number of places. We've generated the Seal America manual. We generated some other manuals on how to develop, kind of a little bit of a cookbook on how to develop a local or community dental program. a dental public health program. So, you know, getting an award like this, and I have to say, and I'll say a little bit at the very end of this today, but it's you know, Myron was the next, Myron and I basically were able to start this, but Myron and I are pretty much getting ready to, you know, we're close to that point where we hand off things to the next generation of folks. And I want to say to all the folks on this call and those that aren't, that the voice of people working at the community level is extremely important. It determines whether programs are going to be effective or not. You all know your communities, you know what the needs are, you know what the habits are of people in your community, and you know what works. And you're also the testing place to try things out. And so if your voice is to be heard, and if you all are to play a role, and it is an absolutely essential role, then the way to do that is to keep this organization going and to become a part of it, and to be active and to contribute. None of this happens because somebody else does it for you. If that were the case, not much would happen. We all have to get involved. We all have to do it. And I just want to say that it's been one of the joys of my career to be able to work with this association and involve people at the community level and have our voices heard. And so with that, I would just say thank you so much, not only for the award, but for the opportunity to have spent a great deal of my time over the years on behalf of local programming. So thank you.
Thank you so much, Larry. Such a pleasure to have worked with you in this year's webinars. And with that, I would like to ask Myron. I know Myron is on the phone. He's at the rehab currently, but he was able to join us in the morning. So let's see if we can get Myron connected and say a few words. Myron, are you on the line?
Yeah, I'm on the line. When I'm speaking to the group, will I know I'm speaking to the group?
You are speaking to 103 attendees. Yes, you are.
I'm doing it right now.
You are doing it right now.
They can hear you.
Everybody can hear you right now.
Hello, everyone. Thank you for coming to this meeting. I got a couple of things to say, but let me start off with when we hired Larry Hill in the early 1970s in his bell-bottom shoes, bell-bottom pants and elevator shoes. I never thought he would elevate himself to do all the things he's done for public health and community health on the local level and national level. And first impressions aren't always what they give you for the future. And my initial impression was him was, boy, he came in as a clinician. I said, gee, this guy's in another world. But great turnaround, and he's done an awful lot. And he's been the backbone of this association. Just to tell you a little bit about myself, you know, my name's Myron Allukian Jr. On April 1 of this year, I entered the emergency room at the BI hospital. I was on a ventilator for 14 days. I almost died twice. Then I was in intensive care, and now I'm at the rehabilitation center. And this, interestingly, during these proceedings, I had the feeding tube removed from my stomach. So I just had an ice cream. It's the first time I've been able to eat something without a feeding tube in my stomach. So I'm just thrilled to be here and be part of this ceremony. It's not every day you get to have the opportunity to come back to life, essentially. I do want to thank the awards committee, Alice Horowitz and Jay Balza, for their help. And I just want to say a few words about the recipients, the awardees. Let me start with Ellie. I first met her in the late 1980s when I was brought by the Dental Health Foundation to get something moving in San Diego. And it took quite a while, but we finally achieved that. And in addition to the legislation, one of my former students got a job in California, and he called me. And he has spent a lot of time in my office. And he said, Dr. Allukian, I've got a new job. I have to give out $250 million a year. That was Steve Uranga McCain. He became president of the California Endowment. I don't know how he's doing today, but I know he's had some difficult times. I said, Steve, you got to give a lot of money to fluoridation. He ended up giving $15 million. And you never know where your students are going to end up. But Ellie persevered, you know, she's still involved. And it was great that she got this award. Gayle, Mathe, John Rossetti would have been thrilled and pleased to have known you, Gayle. John worked for HRSA. He was a doer, always got things done, always talked about lining up the stars. You lined up the stars, and you got an awful lot done for the people in California. And for hygienists to be so influential to improve oral health in the largest state in the country with 40 million people, my hat's off to you. Then Huong Lei, she came to this country in 1975, fleeing Vietnam. In 1965, I was with the 3rd Marine Division at the field hospital outside of Da Nang, where we saw mass casualties. And because we were free in the afternoon, I started a people-to-people program, going into the orphanages and the schools and the refugee camps. And it was at the Buddhist orphanage where they sang a thank you song at the end of the day. And I said, this is what I want to do the rest of my life, is help those who are most in need. And I ended up at 3 years at Harvard in public health. And I've been thrilled to be able to work with so many of you to get so much done. Larry's been the backbone of AACDP. I don't know how he does it. He's unpaid, and he works night and day trying to keep the organization going. I want to thank our core planning committee with Jay, Bahar, and Jared, and Larry, which did most of the early planning on this. If we're going to have a future in the oral health of the most underserved, we need new blood. Those of you who are listening, you've heard the stories. You've heard what stimulated, inspired us. But we need you to get involved with our organization and our association. We weren't even sure how our meeting was going to end up in San Diego, and it ended up great. We're in Orlando next year. I don't know what's going to happen with COVID, but we want to get you going on some committees. Send your name in to Larry that you want to get involved with our group, whether you're young or old, it doesn't matter. But we need to let people know that oral health begins on the local level. Thank you all very much for this opportunity. I'm in my hospital bed, the rehab center. I'm hoping to be out within 2 or 3 weeks. I'm learning to walk again and to eat again. But thank you all for all you've done.
Thank you so much, Myron. We are so proud of you and so honored that you were able to join us today. Thank you for everything that you have done. And thank you for all of our awardees to be here. We really appreciate your presence in this virtual platform. Fantastic. Amazing award ceremony. And with that, we are going to go to the second phase of our day today. We are going to go through our presentations, hot topic presentations, and I'm going to bring Miss Lynn Short to give us an overview and be the presenter of this, the moderator of these parts. Lynn, here you go.
Thank you so very, very much. I am incredibly thrilled to be moderating this particular session today. I think it's a perfect day to be focused on hot topics. The experiences of our awardees reminds me that dentistry has always stepped up and have been in the forefront of innovation and coupled with evidence to form practices that can be replicated to improve the health of the public. It's my great honor to introduce our first speaker, who is Dr. Steve Geiermann, a retired captain in the U.S. Public Health Service, serving the Indian Health Service and federally qualified health centers, as well as a HRSA regional dental consultant for the Midwest FQHCs. He's now a senior manager addressing access, community oral health infrastructure, and capacity within the American Dental Association. So Steve, thank you so much for being with us today.
All right, thank you. All right. Well, I'm assuming you can hear me. I can see your phone, Myron. Hello.
Yes, we can all hear you. Steve, you're on.
All right, cool.
Hi.
So, if we could have the next slide. Thank you. If this was a feature film, this would be a really interesting story, and it would be one of those long 3-hour stories. We don't have that much time. Next slide. We'd start with this. People would think, yeah, safety. First, do no harm. But what you're going to get today is the trailer. If you were at the movies, it's going to be something that will hopefully want you to come back so you can get the full story. And a few provisos. I don't read my slides unless there's something really interesting on them. I'll be talking around them. You should read them. But you should consider, next slide, that this is going to be fast-paced. We're going to try to grab your attention, and we're going to keep moving forward. Because let's just say if we were at the Cannes Film Festival, they would have found this talk intriguing. People at Sundance would have said, yeah, this is socially relevant, long overdue. But when it had a private screening by the local dental society critics, they were not so pleased. And they said, I'm not sure that this story will sell because it's going to be too costly for my practice. It will result in increased regulation and legislation. And Steve, I think you're telling my patients that I'm unsafe. So I want to tell you otherwise. Next slide. These are current assumptions. Community dental programs are blessed because we may be a small portion, but we really embrace safety in a manner that it's part of often our funding, it's part of how we treat one another and how we try to make ourselves better. Our private practice colleagues, they also strive for safety, but they don't always have the same, let's say, regulations or I don't want to use the word commitment, or emphasis that we do within FQHCs, city health departments, so on and so forth. Next slide. So what I want to do is, this could be easily an hour-long talk. We're going to do it in 10 minutes. So we're going to fly through this. And this is all about information sharing. And I'm going to point to many things. I don't want you to be this guy. I want you to be informed. Next slide. So I want to start with what's good. And I work at the American Dental Association, and there's a lot of good stuff about safety happening. And I just pulled these from the ADA News and fairly recent. But from pediatric safety to fluoridation, new standards of all kinds of things, there's some good things happening there. Next slide. I had prepared this slide deck before I went into being sheltered because of COVID. This was not what I was thinking about a culture of safety would mean. I was actually called to Huntsville, Alabama, early on in my time as a HRSA regional dental consultant, because this is how they were treating HIV patients. And I had to explain to them what universal precautions were and what dignity to a patient was. Now, about COVID, who knows what we'll be wearing and where. And many people have said, Steve, what a perfect time if you're pushing a culture of safety in dentistry, COVID will be your catalyst. It's actually a blessing and a curse, and we'll end with that. Next slide. So I do want to say, COVID aside, in the United States, medical error is actually the third leading cause of death in this country. Next slide. You ask, how many people died in a dental chair? One is too many. There aren't a lot of studies because there isn't a lot of reporting. But we were able to do a literature search and we could verify 218 people had died in the dental chair between 1955 and 2017. Next slide. Safety is reducing preventable harm for ourselves, our patients, and caregivers. It doesn't happen automatically. Next slide. Those of you who are of my generation, and I've been a dentist for 38 years. B.B. Black and I probably went to school together, but I do remember starting off in the Indian Health Service, we did not wear gloves or masks. I can honestly say the second one doesn't apply to me, but I know dentists who would use stainless steel needles and sterilize them in a Bunsen burner. Opioids were given like candy sometimes. I wore whatever was comfortable when I went to the clinic. We used rubbing alcohol often to disinfect and wipe things down. How many of you remember asking your patient or yourself to hold an X-ray in place while you were taking diagnostic shots? Smoking happened in the office on a regular basis. Nitrous machines were not well regulated. And there were no immunizations for hepatitis. At the time, I was one of the first people to have the trial hepatitis B vaccine, and that was in 1983. Next slide. And you may think, none of this applies to me. Think about your office. And I just want to point out the very first little phrase there, tripping hazards. One of my colleagues, who is a practicing dentist, last week tripped over a cord in his office, caught himself, but he could have had a really bad fall. He mentioned it to the dental assistant he was working with, and she said, you know, you were the fourth person this week to fall over that cord. Obviously, there's an issue there. And just walk it through all of these various scenarios. And this did not even have a COVID shroud covering it. Next slide. If you read through this list of adverse events, I've had 3 of those. And I think those of us who are practitioners, by the grace of God, if you haven't experienced one of these, but they often happen. And the challenge is we fix it, we're quiet, and we go on. The illustration is often given about pilots and aviation. If I was a pilot, do I need to crash a plane to know how not to? Obviously not. Every adverse event in aviation is documented, and they investigate why did it happen and what did they do to actually try to avoid it in the future. And it's part of the training. So I can actually, as a provider or a pilot, avoid an adverse incident by actually learning from the experience of others. We don't have that in dentistry. Medicine started down this road 20 years ago, and they're still working on it. Next slide. It's all about passion and what your experience is. If you haven't had those adverse events, you just keep moving forward. As I said, within FQHCs and other community-based programs, it's part of our culture. We have morbidity and mortality review if you're tied to a hospital. We have infection control meetings. We talk about improving quality. When you're a private practitioner and you're in a cottage industry with no requirements for reporting, no data, clearinghouse, and little transparency, how can I learn from others? I basically have to experience it. We don't know what we don't know. Next slide. Back one. Those of you who have a legal bent, you may have thought when I said transparency that does this increase lawsuits? Next slide. I can tell you at the University of Michigan, my alma mater, in the medical area, when they started being upfront about medical errors, their liability reduced by 59%. It's the right thing to do, but we're often afraid to take that step. Next slide. If we fail to govern ourselves, and that's what it means to be a health profession, others will step in and do it for us. Next slide. Gary Picard, Pacific Dental Services, made the point. We must acknowledge that if we don't do it, there will be a lot of legislation and regulations. Uncle Sam will help us. Next slide. There is very little literature that talks about adverse events. Next slide. This is the challenge. Sedation deaths in Texas. A kid who was on oxygen, who somehow there was a spark and the gauze ignited in his mouth. And just go down the list. If it's sensational, the media wants to talk about it. Think about COVID. If a dentist, staff, and 1 or 2 patients are sick, what does that do to us? And my time is almost up, but I want to give the example of, think about HIV and David Acer and Kimberly Bergalis. David Acer was the dentist in Florida that allegedly infected 6 of his patients with HIV. That is what moved us forward with gloves, with masks. But there wasn't a great love or a movement. Organized dentistry fought the idea of sterilizing handpieces. Again, too costly. It'll take up too much time. There aren't enough handpieces. It was only when 60 Minutes was going to run an expose on what happens if you don't sterilize that handpiece, that moved us forward. So with a culture of dentistry, I'll end by saying it is not well thought of right now because everyone thinks safety is something that we're about, but we're learning on a piecemeal basis. COVID may seem like the catalyst to move us forward, But the challenge is the fact that to many of our peers, if we tie a culture of safety to all the things we're seeing with COVID and reopening, when we finally get back to whatever the new normal is, and we try to move forward a system of reporting and trying to learn from the experience of others, many of our colleagues will say, already did that, I'm open, we're moving forward. We have taken the stance, we're waiting. We're going to let COVID move for a bit, but we're working underground. And I'll end by saying, what I will share, this slide deck is in there, but I will send to AACDP the actual full series of slides with annotations, as well as the 2 resolutions that talk about developing a culture of safety. It's very insightful, and you will see yourself in it. So as we move forward, my contact information will follow. Feel free to be in touch with me, and we can move forward together. I'm sorry this was so quick. Thank you.
Steve, thank you so very much for introducing this topic of a culture of safety. For all of the audience members, if you have questions for Steve, please use the Q&A at the bottom of the screen to enter in your question. We'll be able to address them all at the very end of the presentations. What I'd like to do now is introduce our next speakers. Pamella Vodicka is a Senior Public Health Analyst for the Health Resources and Services Administration's Maternal and Child Health Bureau. Captain Vodicka is responsible for several dollars that fund technical assistance in support of systems change that improves healthcare delivery to the most vulnerable MCH populations. Also, Sarah Kola will be speaking with her, and she's a communications specialist for the National Maternal and Child Oral Health Resource Center at Georgetown University, and she served in this capacity for nearly 20 years. Sarah enjoys creating and improving communication systems and tools and connecting people with solutions. And it's my pleasure now to have them begin their presentation.
Hello, everyone. This is Pamella Vodicka from the Maternal Child Health Bureau. I'm calling my and Sarah's little presentation today a duet. I am going to basically have a long introduction to the National Maternal Child Oral Health Resource Center, as we do invest in not only the national but also in local efforts, and we're grateful to have them as one of our recipients. Next slide. So at the Maternal Child Health Bureau, we receive an investment from Congress that we're very grateful for, appropriation that is specifically dictated for oral health. Next slide. Over the years, we here in the Division of Child, Adolescent, Family Health, who've been the organizers and deliverers of these dollars, have come to focus on 3 strategies in our efforts to respond to this appropriation. We seek to test promising models, we seek to provide reputable technical assistance and training, and we seek to have a repository and the capacity to develop resources that can impact the daily lives and the efforts of our administrators, health professionals, educators, policymakers, as well as our healthcare professionals, both medical, dental, and beyond. Next slide. Currently at this time, these 3 strategies are sort of split between 2 investments that we have. Strategy 1, which is the promising practices. We are focused in now in what we call the networks for oral health integration within MCH. It's, as everyone who does know us at MCH, we like to have names for our investments, and this is our NOE investment. I'm not going to go into reading the slides. You'll be able to look at it later. This investment started last year. We have 3 awardees. The purpose here is to look for promising practices Strategy 2 and 3, technical assistance and resource. This goes to the National Oral Health Resource Center under the investment name of the Center for Oral Health Integration and Improvement. Next slide. So to just give you a little glimpse of what these investments are doing, our NOEs, we purposely set up a much more complex project as it is that we, in our efforts to look for promising practices, we knew that we needed to have some commonality across our investments so that we could say overall the effort that has been gained can be recognized as being promising and hopefully evidence-based as our effort. The big push for these 3 awardees is to have common measures, common metrics across their projects so that we can sort of cluster everything in one big project. As mentioned, there's 3 awardees, all representing 12 states. Each leading state was to select 3 others, and so we have 12 states represented. And the best practice approaches that these recipients and networks are working towards is, again, to look for promising practices and approaches for integrating oral health into an MCH safety net service. Turned out the 3 awardees were all focusing on community health centers, so that's a nice little commonality across the 3. Also to particularly focus on knowledge and skill building, as well as enhancing the knowledge among our community, meaning parents and our children. Next slide. Here you can see where we're representative. We had regional responsiveness. So we have a cluster of states, not quite to the full west, but in the mid of the country, and then along the East Coast. Next slide. So that was strategy 1. Strategy 2 and 3 is getting the technical assistance out there as well as providing resources. As indicated, the name of this investment is the Center for Oral Health Systems Integration and Improvement. The recipient is the Resource Center. This investment has 3 goals: the provision of training and technical assistance. We have a focus on quality indicators. We're working towards identifying promising indicators that can show us advancement in oral health in the community, in the state, so that we can hopefully make efforts to improve the services of oral health towards the MCH population. And as mentioned multiple times, continuing the resource development and dissemination. Next slide. COSI, as we call them, has a number of partners. AACDP is working with the Resource Center to focus on Goal 1. Here we're providing technical assistance not only to our NOE grantees through the development of a learning collaborative so that there is peer-to-peer, state-to-state learning, and everyone can work together towards the common goal of creating successful networks towards this common metric, the metrics, in order to measure what it is that they are doing in order to improve the integration of oral health and knowledge and skill. Next slide. We have special projects within COSI, again, a benefit of the funding from Congress, which they are leading the effort on what we are calling the Partnership of Integrating Oral Health Care into Primary Care. Here, we were called by Congress to have a focus on the document that was created through HRSA on integration of oral health through primary care, focused on 5 domains, interprofessional clinical domains, for which COSI has done quite a good job in doing. Next slide. We were able to pull together the interest of 5 states. Mind you, we were able to give them a little bit of a carrot on a stick by giving a few dollars to participate. But they're now entering, finishing up their 2nd year, and will hopefully to be able to share information on how they've been able to achieve their project. The focus of improving the integration through knowledge and skill building was focused on using Smiles for Life. They recently presented at a couple of national organizations the outcome. Later in the presentation, Sarah will be able to show you where you can find more information about these projects that we're doing. So go on to next slide. More on the quality indicators. This is a project that was really near and dear to my heart with the development of COSI, was the ability to be able to identify measures that are reputable for the purposes of advancing MCH oral health. COSI is, Oral Health Resource Center is in with partnership with the Dental Quality Alliance, who is kind of leading this project. We have another 5 states that are participating in not only the help to refining the identification of these quality indicators, but also piloting them. There's a little screenshot of Oral Health Resource Center's webpage. Again, Sarah will get more into detail about that later. But all of these projects that we have funded through the MCHB, the Resource Center has done a great job in being able to highlight them. So you won't just have my slides here to reflect back on. I just offer that you go straight to the Resource Center's website and able to learn more about them. Next slide. Also under strategy 2 and 3 is just the 3rd goal of developing resources and being able to disseminate them. I don't think I really have to give a big introduction to the National Maternal Child Oral Health Resource Center, though we will get some insights and sort of the current efforts that they have in being able to walk through their website, which Sarah will do here shortly. Here I'm just highlighting a few of the products that we've been able to produce so that to be sort of up in the current efforts and what's going on. So you see fluoride varnish, silver diamide, references in fact sheets for opioids and such. So next slide. Contact, I'm going to go quickly here. Maite Canto is the project officer for NOE. I'm the project officer for HOSI. Next slide. Per requirement of HRSA, I need to let you know how you can get in touch with them. Move on to the next slide. And so without further ado, I'd like to introduce to you all, and doesn't need an introduction, the Oral Health Resource Center. Sarah will be presenting. Next slide. And just to give you a kind of an idea, the organizational chart of HRSA and where it all comes from. So the money comes into the Health Resource Center, Health Resources and Services Administration. HRSA is made up a number of bureaus, including the Maternal Child Health Bureau. Much of that money that the Maternal Child Health Bureau receives is the Title V dollars that goes out to MCH block grant and what we call our SPRANS projects. And under our SPRANS projects is the COSI investment. Next slide. So here I'm going to turn it over to Sarah so she can go over the learning objectives as well as walking you through COSI, or through the Oral Health Resource Center.
Hello, everyone, and thank you, Pam. Thanks for that handoff. It's a great explanation of the MCHB investment and helpful to understand that MCHB is the funder and all of us are the grantees. So I'm not going to take a lot of time on this because we're running a little bit low. Yeah, you can go next slide, please. And go past this because Pam kind of covered this. Here's our URL. Of course, you can just Google us. And the next slide, please. I'd just like to spend this time to invite you to feel free to contact us if you'd like a personal web tour, or if you'd like me to arrange a web tour for your organization, or any other questions about the Resource Center. If you could just go back one slide, please, Katie. I just wanted to spend 1 minute here on our homepage and encourage you to explore freely and contact us whenever you'd like help. If we can pique your interest to get involved with the services that we have to offer and that you can reach out to us. You're invited. Of course, there's a left navigation bar, and that first item on the left, it says Cozy. If you click there, it will expand and show you links directly to those project elements that Pam was discussing. In the middle, those are our news items, our recently released materials. We do have an updated page on federal agencies and national organizations' recommendations and guidelines on COVID-19. And on the right there where that circle is one-click features to our most popular resources. So next slide, please. Real quick, we offer many consumer materials in English and other languages, in addition to all of our materials for professionals. And everything we do is on our website. Everything we do, you can use, download, print, and share in their entirety. There are permission statements on all of them. If you'd like to excerpt or use any of our information in your own productions, we just ask that you ask permission, and I'll show you real quickly where to find that. So we can skip through a few more slides here, Katie. In the interest of time, our consensus statement is readily available. We also have distance learning online that offers free continuing education credit to dentists and dental hygienists and dental assistants. A very robust library site and this cool timeline of oral health milestones in public health. Keep going, you're doing great. And our publications are all listed by category and by date, so it should be easy to find. I'd like to just highlight one more slide, please, Katie. Yeah, the About Us section at the top is where you can explore, next slide, please, contact information for us. And if you scroll further down that page, next slide, please, you'll see a link to disclaimers, copyright, and permissions. Click on that, and next slide. You'll find a sample letter you can download to adapt and tell us how you'd like to use our information. And that way we can help you not recreate the wheel, reinvent the wheel, but use our information to help you produce your own materials. Next slide. So that was a very quick tour, but again, I'm very happy to help you individually and welcome your contact. Next slide. And we do have a monthly e-newsletter. I've neglected to point out on our homepage down at the bottom, there's an envelope icon that you can click on to subscribe. Thank you.
Lynn is going to join us in a second.
Oh, yeah, thank you so much. Thank you very much, Pam and Sarah. Again, please, if you have questions to ask the panelists, please feel free to pop those questions right in the Q&A, and we'll be getting to them quite shortly after our next presenters. I next have the pleasure of introducing Johnny Johnson, who's a pediatric dentist as well as co-founder and president of the American Fluoridation Society. Dr. Johnson has delivered presentations, training, and testimony about fluoride in numerous states. His leadership in fluoridation advocacy began after his own county commission in Florida voted to end fluoridation, a decision that was successfully reversed. Tuka Zokai is the manager for fluoridation and preventive health activities at the American Dental Association. She leads the National Fluoridation Advisory Committee and the Prevention Subcommittee for the Council on Advocacy for Access and Prevention in the Government and Public Affairs Division. Her work includes educating community leaders on the efficacy and public health benefits of community water fluoridation. Please begin, Dr. Johnson.
Thank you, Lynn. I mean, it's short. Good morning, afternoon. Next slide, please. I want to thank you all for allowing me to be a part of this fantastic group and giving some information. Many of you are my mentors, and I absolutely never stop learning. I'm not a public trained dentist, public health. I'm a private practitioner that just got angry. I want to go over what's happening now, and one thing is I put community dental centers instead of programs. My apology for that. Next slide. I'm going to emphasize a couple of things, and you need to keep it in the back of your mind when you have challenges, the hot topics. Fluoride is a natural mineral, period. It's been around since the beginning of time. Next slide. Fluoride is the 13th most abundant mineral in the Earth crust, and it's in almost all water naturally. And I said I was going to do this from sea level, and speaking of sea level, seawater contains up to 1.4 milligrams of fluoride per liter. That's a natural mineral. Others will try and tell you that what we drink is a man-made, fabricated mineral, but God never had an 8th day where he created that in Genesis. Next. What we did through discovering fluoride back in the 1900s early was to replicate it through studies, and we found that Mother Nature taught us. We replicated it, and the rest is history. We have now had 75 years of fluoridation in the United States. Wonderful, wonderful public health measure. It is our immunization against dental decay. Next. How did the anti-fluoridationists acquire their target places or their cities? And I've been asked that often. I can tell you only God knows. But I will give you an overall kind of a snapshot. Next. They like to pick on small targets locations. Getting fluoridation stop in a small community is a bragging point for them that they can call, well, we stopped this number of cities in this amount of time. And now, like, they are basically winning the battles, and fluoridation is going down the tubes, and that's not the case. Just recently, within the last year, I listed on the left some challenges by the opponents. We know who they are in this country and in Canada. One has been 3 times and now a 4th time being challenged. Even the state of New Hampshire, plus some many states have heavy challenges, and Pennsylvania and Texas being 2, Missouri being another. We are working and winning those. We're getting the cessations put away. They're not happening. Also, one great thing that needs to be remembered is that initiations are key to winning these battles. The bandwidth of anti-fluoride group is not there. They cannot battle initiations and challenge communities at the same time. And I know firsthand that they have no way to do that, and that's gaining in popularity. Next. A second hot topic that I want to mention is IQ and health, and we all know what the JAMA Peds reported last year on Ripu Green and et al. Study. Next. That to me was the greatest study for fluoridation that could ever have been produced. And I say that because it brought researchers, medical statisticians, people from every walk of life around the world out of the woodwork immediately. It didn't take a year or 2 or 3 for the normal type of evaluations to be done. They came out quickly. In Calgary, Alberta, which was 1.3 million people who stopped fluoridating 2011, we saw many studies done showing increases in decay. Well, CAPT, which is a Canadian authority agency for drugs and technologies in health, evaluated that study and said it is weak, and it is basically has numerous potential errors, and it is not a study that is strong. Next. There have been additional studies which have found no effects of fluoride at the levels that we are using in water fluoridation on IQ, not a single one. Next. Research on fluoride safety has been done in Ireland, showing no basis to suggest any health concerns at the exposures that they're receiving. Next. Experts recently weighed in on toxicology, and they, in Europe, concluded that there is not support for presumption of fluoride being a human developmental neurotoxin at that level in Europe being used, which is similar to what we are using. Next. What happens when fluoridation is stopped? This is exciting. It sounds sick, but I'm excited by it. Next. We finally have data that shows what goes on when it stops. 3 cities I will mention here. One is Juneau, Alaska. A study there showed that dental disease in preschool age children under the age of 7 ended up requiring 1 more additional cavity per child per year. Calgary, cavity rates there in the first 3 years that fluoridation was stopped shot up 146%. And Windsor, Ontario, Canada showed that when they had stopped and then evaluated it again at the city council's direction at it 5 years afterwards, their needs for emergent dental cares and cavities increased by a 51%. They voted to return fluoridation. Calgary's in the process of doing the same thing, looking at restarting fluoridation for 1.3 million people. Next. Again, this just shows the Alaska study. Next. Recent research also confirms water fluoridation's benefit. There was a study done in 2018 that looked at 3rd grade kids in a fluoridated community. They would have 39 fewer decayed teeth than those in non-fluoridated communities. Next. Credibility of the leaders of the opposition. We know who they are. Next. This is my donkey, Rita. Behind her is what comes out of the back end. If you throw it at a wall often enough, the anti-fluoridationists hope that something sticks. It ain't gonna happen. Next. One of the leaders of anti-fluoridation is in the United States. He's from Britain, the UK, a PhD chemist. Next. The Royal Society of Chemistry looked at all the pro, and they are neither pro or anti-fluoridation, but they looked at the science and based their studies and based their decision on water fluoridation strictly on that. And they said on the basis of published robust evidence in water fluoridation, it was both safe and effective in reducing dental decay. Next, the lead fluoridationist in the United States, Paul Connett, the PhD chemist from the UK, he is out of step with over 58,000 worldwide members of the Royal Society of Chemistry. This has taken him out of the equation, and he is ineffective in doing his work that he has been doing in the United States. Next. Who is most critical in this effort? Well, these two I will tell you very rapidly. Water operators have been targeted heavily by the anti-fluoridationists. We need to continue to work with water operators and let them know the huge benefits that they make in water fluoridation. By simply fluoridating the water, they reduce operating rooms with general anesthesia full mouth restorations for early childhood caries by 2/3. They are amazed to see that. Next. And lastly, our politicians. When they make a bad decision, we have to vote them out of office. This takes collaboration between the private and public sectors. Together, we get things done, and we will continue to. Next. I know this was quick. I appreciate all of your time listening. I could go on, but I have been told my time is up. Please visit us on the AmericanFluoridationsociety.org website. Thank you all very much for listening to me this morning. Be happy to take any questions later.
I was on mute. Thank you, Dr. Johnson. And I think that we're going to be having Tuka, so Kai, speaking next.
Yes. Oh, here we go. Thank you for the introduction, Lynn, and thank you, Dr. Johnson, for kicking us off on fluoridation. I also just want to say I'm so honored to be on this panel today. I'm speaking alongside many of the individuals that I truly look up to and I'm inspired by in leaders in oral health equity, advocacy, and equity. So thank you so much for this opportunity to present today on community water fluoridation. Next slide, please. So I have 2 polling questions. I'm here to wake everyone up. I know it's been a lot of conversation. So the first question I would like to get some information on is, has your community faced fluoridation activity in the last 5 years? So that's something like an initiation, a rollback initiative of community water fluoridation. So please answer to the best of your ability. You should be able to answer in real time with the poll open right now. And this is just to kind of get an idea of the audience today. So again, it's if your community faced fluoridation activity in the last 5 years. And you can define community however you choose to for yourself. So really the community that you are part of. Okay, so seeing the results right now, it's about 39% of you have, and 36% of you haven't, and 25% are not sure. So pretty good distribution there. There's just one more question I have for you. All right, so have you advocated for community water fluoridation within your community in the last 12 months? And this time, community is really to any member of the community, a legislator, a decision maker. And so this could be if you're a provider, if you've spoken with a patient. So really it's have you advocated for community water fluoridation to some capacity. And this is specific to community water fluoridation, not necessarily fluoride varnish for this question. All right, let's see the results. Great answer. So 58% of you have, 43% of you have the opportunity to do so. So hopefully after some of today's presentations, if you'll feel more comfortable to advocate or know where to get resources to. And that's a lot of what I'm going to offer today. So Dr. Johnson did a great job of introducing kind of the science and that it is safe and effective, but I'm here to give you a little bit more of a resource. So just some background, looking at 2019, there were 9 communities that initiated or reaffirmed water fluoridation. And then the states are listed there with the green arrows. And there were 7 communities that actually rolled back. So kind of to echo what Dr. Johnson said, it's not that there's this downward spiral of water fluoridation efforts in communities, but we do have a lot of opportunity to continue to advocate for it and effectively and strategically respond to those that are hesitant. Next slide, please. So here are a couple of resources for you through the American Dental Association on different methods of addressing water fluoridation. So to the left of your screen, you can see A Mom's Guide to Fluoride by Dr. Brittany Seymour. And this piece, she's speaking not just as a Harvard professor, a dentist, but as a mom. And it's meeting the community where they are. A lot of individuals, they trust people who identify to similar groups as themselves. Even ourselves in the oral health community, we like to speak to other people in the oral health community. But those that are fluoride hesitant or unsure, they may identify with other groups that they are choosing to trust. And to meet them there is part of the strategy to share this science. So A Mom's Guide to Fluoride is a piece on Mouth Healthy. There's the link there, but you can just search Mom's Guide to Fluoride, Mouth Healthy. And that piece is very powerful in terms of bringing in a new approach. And then we also have, the clinical side and the science side. So some folks, they may go to the internet and find information there, and others want a peer-reviewed, evidence-based pamphlet. And that's all to the right of your screen with the Fluoride Nature's Cavity Fighter, and that's a pretty new pamphlet as well, so it's recently been updated, and that's something that you can have in your offices or give to communities, give to community centers to have as a resource in-house, and it's a really great evidence-based piece. Next slide, please. And then, of course, there's the evidence itself. So, those two are very health literate pieces. They're for a broader audience. But then you have the Journal of the American Dental Association has a number of pieces on fluoride and fluoridation and studying the science of it and the efficacy of it and looking at different impacts of fluoride. And this is something for if someone is trying to get really into the research and they're pulling up papers that aren't necessarily peer reviewed. There's also these resources for you as well. And we have a specific link on our American Dental Association fluoride pages, which archive specifically fluoride related. So we kind of do the research for you to look at. Those on the webinar. Next slide, please. All right, and then what I like to consider the Holy Grail. So there is a document that is an ebook form, PDF, or a printed version called Fluoridation Facts. Now, this book is put together through the peer review evidence of the National Fluoridation Advisory Committee. They went through a number, I think it was about 200 papers related to fluoridation, and they use this evidence to answer common questions on community water fluoridation and fluoride in general. And if someone has a question on fluoride, so what is fluoride's impact on bone development, there will be a question in this book that you can look to that will have the answers there and the evidence, the scientific articles that they came from. I really recommend this book. It was most recently updated in 2018, but it's more accessible now than ever with it being freely available in its digital form. You could still order the book, which is great to give to legislators or decision makers. But if you have a question and you want to get the answer in a peer-reviewed format, this is a wonderful resource for you. And again, I'm sure there are plenty of resources outside of the ones that I've mentioned today, but these are the ones that I just wanted to guide those on this call to. So thank you for the opportunity for me to share that. Next slide, please. All right. So new research. I know that Dr. Johnson mentioned this, but there's always new research that can lead to confusing headlines, conclusions, and ultimately that leads to confused members of your community. I know Dr. Johnson dived into some of the individuals, like the key players in fluoride hesitancy and anti-fluoride advocacy, but really a lot of the time it's an article comes out and a headline confuses an individual because of how they interpreted the study, and it leads to a smaller community making a decision about fluoride without considering the true meaning of that evidence. So next slide, please. So I'm going to do an example of the JAMA pediatric study and kind of how this circulated with the media. I know many of you on the call are familiar with this. So again, this was already mentioned. So and just to consider time, we'll go to the next slide. It basically had inconsistent findings with the rest of research. So the IQ implications of that study, they weren't replicated anyway in any other study. They were truly not conclusive. And it offered an opportunity to call for more research, but that individual finding isn't a strong enough study to be able to say, we need to make a change on fluoride or we need to reevaluate our recommendation on fluoride. So next slide, please, thank you. Obviously, that's not what the media thought. And of course, with something that has public health is the #1 reported arena in the media. And of course now with COVID, but even before then. And these are the kinds of headlines that parents saw. I mean, my sister, who's a mother, called me after the study dropped, and she was very concerned about fluoride. Luckily, she could call me and I could guide her to resources, but not all parents have that kind of opportunity, and they're sharing it with each other on their parent pages, and it's a cause for concern when this is the kind of images linked with a headline. For those that may not understand how to interpret the science, it leads to fear. And and honestly, these folks are innocent. They don't understand how to necessarily get the best interpretation of the science. And I've fallen privy to headlines before myself. So I think that it is up to the scientific community to really engage with individuals where they are to help explain this evidence. Next slide, please. as we can see, leaders in research, they were giving statements on the limitations of this study. But these resources from the American Dental Association, the American Academy of Pediatrics, you're looking at public health universities like Johns Hopkins, this is not where individuals, most lay populations, are getting their information, even though this is where those who are leaders in science. So we have a huge opportunity, especially for those who are here today, to get innovative with where leaders in research are sharing their information, because we are in a privileged group where we can speak to other privileged groups. And I think we have to be able to get creative with how we speak with other wonderful parents, community leaders, faith groups, leaders in society, and show them the evidence and have conversations with them rather than being in our silos. Next slide, please. So the National Toxicology Program Fluoride Monograph, I am unfortunately going to be out of time soon, but I did want to draw attention to this in case you come across it. There was a draft monograph that had a conclusion that a moderate level of evidence that high fluoride exposure is associated with decreased IQ. Now, this was just a draft monograph, and it also was based on a lot of limited evidence for that draft. Next slide, please. So again, that was the draft conclusion, but there's a plot twist if we want to go to the next slide. Sorry, I'm running through this. I know you all want to get to lunch. So the American Dental Association did write a letter to the monograph committee. We asked them to change the hazard clarification from a presumed neurotoxin to unknown, because that's truly where the evidence is at. And it is important to have a modifier when we're talking about water fluoridation and optimal water fluoridation. So fluoride in general, everything we consume has a threshold effect. If you've ever had too many gummy vitamins, you know what I mean. So it's very important to add a modifier when we're talking about fluoride as well. That's some excerpt from our letter. And this had an impact. So it wasn't just our letter alone. It really took an oral health community and a healthcare community writing letters for their concern to this draft monograph. And it did have an impact. Next slide, please. Those are the concerns of the monograph. We can go to the next slide. So the national academies do not support this draft monograph conclusion. So in March 2020, pretty recently, the national academies reported that it does not find that the NTP has adequately supported its conclusion. I am out of time, so I think that's about my last slide. Yeah, so that's our National Fluoridation Advisory Committee for you to know who we work with. I do want to announce that we do have a webinar series on fluoride coming up. So this was, again, trailer, as Dr. Geiermann said, and you can get a deep dive. That's my contact information. It's always great to be last but not least. So thank you for this opportunity to present with a wonderful panel today. Yay.
Thank you so much, Tuka. And I would like to invite all of our panelists to join us so that we can have a Q&A here. Fantastic. And I wanted to also announce that we are going to go for another 5 or 10 minutes over time so that we have that opportunity to ask some questions and just get some clarification about what they presented. It was a short amount of time, but all of our presenters did amazing to summarize the hot topics that we have been covering today. Fantastic, thank you so much. So, Lynn, take it on from here. Any questions you have for our panelists?
Sure, so thank you so much. Steve, I wanted to ask you a question first. We want to go as far upstream as possible to promote a culture of safety. How should this culture, the possibilities and the challenges, be introduced to assure that the information is incorporated into caring for patients at the very start of a dental or a dental hygiene career?
Great story, great question. So at the end of my presentation, there were 5 major topic areas that our medical colleagues used starting 20 years ago when they tried to move their culture of safety forward. When we evaluated those, they made perfect sense for us. And the very first one was about educating both the current providers as well as those who are in training. Because the old guard often, they're a pretty tough nut to crack. But when new folks come out with new ideas and they can bring it forward in such a manner that they're not completely rocking the boat. My goal is slow and methodic, and helping dentists especially think that they thought of it first. No skin off my teeth. I'm happy to move them forward in that manner. With hygiene, it's the same thing. Helping them understand, and especially using a COVID model. If we're concerned about aerosols, it's one thing to not have sonic scalars, whatever you want to call those, but it's not just that. It's the whole idea of aerosols, and it needs to be a team approach. So I would just say, when you look at the CDC guidance, at the ADA guidance, but look at OSAP, look at NIOSH, and there's a difference. Everything is evolving. So I wish I had a really short answer for you, Lynn, but I would just end by saying, evidence-based dentistry, we all believe in that. But it's a three-legged stool. And many of our colleagues get fixated on, is that evidence-based? And it's like, I'm sorry, this is a new beginning. There's not a lot of evidence that is pertinent right now to COVID. It changes continually. The other two legs of the stool, how does it fit and serve in my hands as the provider, hygienist, and dentist? And how do our patients accept it and perceive it? We need to make sure that we're balancing all three of those. So I would just say, if I'm the old guy that, you know, it's like, oh, I just want to open my practice and just continue, and I'm sure things will be safe. If the hygienist needs to politely take me aside and slap me, that's his and her role, and I should be a professional enough to hear it and to say thank you.
Thank you so much for that answer. Again, I just want to make sure that people are asking questions in the chat. I'm sorry, in the Q&A if they have them. And also one of our attendees thought that you made some great points, Steve, in that response. So thank you again for that. Sarah, I was just wondering if you could tell me, I didn't hear anything in regards to cost for the resources at the Maternal and Child Oral Health Resource Center, and also how are the resources developed, and what role could our audience members play in creating or providing feedback to the resources that may be provided?
Oh, great questions, Lynn. Thank you. First of all, there's no cost for anything that we do because we're federally funded. So feel free to use our materials, and we used to print and ship. We don't do that any longer, but everything is available to people on the website at no charge, including the distance learning. There's never a charge. Our materials are developed usually with a primary writer and then several reviewers. We have an advisory board in our work, and we share materials with those folks. We also reach out to other experts in the field to do external reviews. And of course, it's reviewed by the Maternal and Child Health Bureau. We do take submissions for ideas on emerging topics. Recently, in the past year, we developed a couple of resources about opioid prescribing and pain management in both women and children. And that was a topic that came in from the field, somebody looking for that fact sheet. Similar now with all the increased emphasis on teledentistry and COVID-19 and silver diamine fluoride, all these emerging topics. We're coming out with new resources. Generally, they hit our website first in those topic pages, because that's where we can show what we've collected and cite some key facts from the professional literature then we tend to move from that to a fact sheet that we can publish ourselves, and then we have resource guides on topics. So anybody is invited to contact us with topic ideas or to report a gap that they feel in resources that are available. And if you'd like to be a reviewer, we'd love to have your comments.
Good, thank you so much. Pam.
Lynn, this is Pam. I'm gonna tag on to Sarah because it's a new request that I made, and I believe it's still enacted in the last couple of resources they developed. When you bring the resource to the page and able to download, we're still doing the Q&A, Sarah, where we're asking folks when they take that resource, that new resource, and begin to use it, we're asking for immediate response. We would like to know how you're using it, if it's working, if there's any way that you see that it needs to be tweaked in order to be better user-friendly, or if in a different format or in a different frame in how it can be evolved in a different way. Because what we're really trying to do is make it very applicable to those that we're hoping to serve.
Right, so the landing page for our resources now has a short SurveyMonkey link on the very same page. And we do respond to those comments quickly and can fix some things or adapt some things or take it under consideration otherwise. So we welcome your feedback.
Perfect, thank you
so
so
much.
much.
And I wanted to add that given our situation with COVID-19, these resources are going to be even more important for people, or adopting them to for oral health education virtually or otherwise. So thank you.
Yeah, we'd love to hear from the field what types of resources you're needing in these times.
Great, thank you.
Pam, my next question was actually for you. Having worked in a health department for close to a decade, I certainly recognize the challenges of sort of those siloed programs and getting that integration model with oral health and maternal and child health. I noticed on the website that there's an elevator pitch that's available, and I'm gonna have everybody actually encourage you all to go there. But I'm just wondering, from your experience, what would you recommend to the audience members if they wanted to approach maternal and child health regarding oral health? What would maybe a key message that they could deliver to sort of even just spark the interest of maternal and child health at the local or even the state level, if that's where they're working?
Thanks, Lynn. Oh, goodness.
Sorry.
That's okay. On the spot, no. For those of you who don't know, I'm a pediatric dietitian by trade. I actually worked almost 10 years in the hospitals and 10 years in the public health field. Was even paid by Title V funds before I came up here, so didn't even know it at the time. As a pediatric dietitian in the community, I was part of a team approach for children with special health care needs. And in my hospital's careers, it was always for chronic care, so that was a team approach. So I come with a somewhat biased opinion and expectation that you are going to work in a team no matter how you're going to work. So my first recommendation would be to think in that framework, in the sense that when it comes to the body, all different parts are represented by specialists, including the mouth, but it all is pulled together as one. I can't name them off the top, but we have some wonderful resources on the Resource Center, a nice little tip sheet that gives you some bulleted statements on what it is that you can say. What I would recommend is knowing who your players are. Some of the health departments where the maternal child health department, division, whatever it's called in that state, may be within different organized sections of the state health department. So where it might have been always in family health, some places you see oral health and chronic health, and you don't have as much connectivity as maybe as you want. So you really need to know who your partners are and getting to know them. It could be the state dental director going to the maternal child health director, introducing themselves and having that talk there. Know your linkages. The Title V program has a national performance measure on oral health focused on preventive care. It's got 2 focus points on prevention for pregnant women and prevention of children through 17 years of age. So you'll want to go prepared to know what it is you're talking about. Recognizing the interfacing in the states so that you make it really very comprehensive in how you're working. The idea of siloing can get so very easily when you just want to talk about oral health. So here's an opportunity, particularly right now with COVID, what I've been passing on to folks when having conversations as a nutritionist, the impact of nutrition on oral health. Now you're dealing with families who are stuck at home, may not have the access to foods that they once had, maybe eating different types of foods than they are. So this whole interface of the change in the nourishment that they're taking in, how that could impact their oral health, need for practicing better oral hygiene at home. If we can have working relationships with that medical side of the partnership, and recognizing they could be the first to ask these questions and then build out from there, and having your resources and your knowledge base. But you have different touches. You have WIC program where your food is. You have Healthy Start where your early health care is. There are all different opportunities of bringing these people to the table. So I would say really begin to know your programs in the state for the touch points on child development, family development, adolescence, pregnancy, well women, and you can begin to put your puzzle together.
I think that your response also, which was going to be my next question, which I will forego putting you on the spot there, was really the promotion of that interdisciplinary work. That we really can't do it all alone, and that we need to have, many different professions being an advocate for oral health, and us being an advocate for their focus as well.
I think that's the important part, is that it's a shared, you're just not bringing them along to support you, but you have an opportunity of supporting them. So
Right.
Two-way street.
Perfect. I was surprised when I was surprised and I wasn't surprised in regards to the first polling question that TUCA put up. And there seemed to be a good percentage of people who are part of this call who didn't, or the presentation, that didn't know what was going on perhaps in their community in regards to fluoridation over a period of time. And I really think that introduces my next question to either TUCA or Dr. Johnson. What could one single person, somebody in this audience, do to support water fluoridation? Oftentimes we sort of think, our opinion isn't important, or our vote, for instance, isn't important, and yet it certainly is in the many different ways that we connect. And I think that even COVID-19 demonstrates, how many people we actually can connect with in a certain amount of time. And if we could just spread, instead of those germs or the virus, if we could just spread the message of fluoridation, we might, make a huge improvement in that regard. But what could one person do? What would that message be?
I'm happy to answer first, and then Dr. Johnson can maybe follow up. I think one of the really difficult aspects of community water fluoridation advocacy is it's a little bit nuanced, right? It's easy to get into the weeds with the question that folks may have about it. And I think a difficult thing is there's a lot of misinformation that is circulating. Luckily, Dr. Johnson actually pointed this out to me, recently there's been some changes with Google algorithms when you're searching about information on fluoride to put up the most evidence-based science first. But it is very easy to understand that fluoride is very similar to the anti-vaccine movement, and that it's easy to get in hubs of misinformation. I think what one individual can do is recognize that they're not alone when addressing this public health practice. And it really is something that if you are supporting, if you're outspoken about it, oftentimes people are silenced by the anti-fluoride community. Similar to someone who may speak up about vaccinations, they can get silenced by the vaccine hesitant or anti-vaccine community. So I think something that an individual can do is to start network building with other folks that also support fluoridation. So they know that they're not addressing this alone. Oftentimes when someone is trying to address something alone, that is when they're kind of attacked and they're vulnerable. Partnership, there's power in partnership. This call is showing that. This organization is showing that. So always, what one individual can do today, if you haven't, is speak with your local oral health coalition, your local dental association or state dental association, and find other partners in practice, and not just within dentistry, if you're in dentistry, but in pediatric medicine and education groups as well. So I think that there's a lot of opportunity in network building when it comes to fluoridation, and early, before you are faced with a challenge. So even if you're in a community that hasn't faced any challenges in a while, it doesn't mean that you're in the clear. I mean, science takes continual education. So that is my big recommendation. Dr. Johnson, any other comments?
I'll go quick. In building on what Tuka said, it takes a village. But the way I look at this is there are several ways we all have to work together. All the different groups within a state and trainings that we provide, our group does, the statewide stakeholders helps to get them talking and off of disagreements. But there's two areas that I focus on, and one is the local decision makers. They're the ones that make these decisions. Reach out to a person on your decision maker group, whether it's a city council member or a county commission, board of health, one-on-one. Don't reach out to all of them at one time, because they'll answer in a lynching mentality. No, we don't want that. No, we don't believe in it. Heard so many things. You reach out one-on-one, and you also take your, you could do this, you could do it with your health. You need to take your health DOH person with you, or whoever is in charge of the community. They know what's going on. The private sector person like myself or someone in the community will absolutely be able to get an appointment much more quickly with a decision maker, because whether they think you're a doctor, they know who is paying their wages, even though you are too in public health. So you get their position on fluoridation, and you also thank them afterwards by sending an email on their public email address, thanking them for their position. We understand that you're not in favor of fluoridation, and that's one other way that I get involved with it, is to have the media on our side, and that's very easy to do. The second thing is, go visit your water plant utility today, or as soon as you can. Those are the folks that are providing safe drinking water to us, and we need to stroke their backs and let them know how much we appreciate it. They know we're there for fluoridation. They know we want to see what's going on and talk to them. But with so many of them being against fluoridation or not wanting to do it because it's not EPA required, when you go speak with them, you become a resource for them, because they get a lot of pushback, anti-pushback, and finally they get sick of it and they quit answering. They say, let's just stop it. And they are the experts for the city or county leaders, just like the engineering department is, like your roads person is, anybody. So when the city council asks them about fluoridation, now toothpaste works just as well, and even the CDC admits that it's primarily topical. How many times have we heard that? But when it is a decision maker's expert, that's what they're going to listen to. We have to find out where those decision makers are, and people running for office, interview them, and we need to let the community know. We have to let everybody know that these people are against public health. They are ignoring public health. Number one, just look to the CDC. Did they stop eating romaine lettuce when romaine lettuce was tainted? Yes, they trusted the CDC. So why don't you trust the CDC on water fluoridation? I mean, just some simple examples, but yeah, down in the trenches, that's what works. And I'm a bull in the china shop. So anyone can contact AFS through me anytime. And believe me, we're always here to help in every community around. Well, we are connected with others around the world. We help each other all the time.
Thank you so much, Dr. Johnson and Tuka, for those great responses and resources. The last question from our audience is for Dr. Hill. Any thoughts or comments on expanding SEAL America guidelines to include COVID-19 infection control protocols for school sealant programs?
Well, I could almost defer to Sarah a little bit on that, but I would, you know, the SEAL America manual has been updated, I think, twice now. Is that right, Sarah? I believe so. And you know, I think all of the documents that we have should be thought of as dynamic documents. This one certainly should be thought of that way. We have a new world out there, new circumstances, and if we were to write it today, I'm not sure we'd know what to write quite yet today, but I can definitely see that coming down the road. So yes, I think very much that's, I think local programs are going to need guidance. There's programs across dental sealant, school-based dental sealant programs across the country, and they are going to need guidance on how to safely provide sealants, both to keep the kids safe and to keep the provider safe as well. Yeah.
We have two resources. We have SEAL America, that's the manual online, and we have a school-based dental sealant programs distance learning curriculum. Both of those are going to need a careful revision. And right now we buy some time with schools out for closure now and then summer. So we're working on those issues now to try to find out whether they'll be suspended or what revisions are needed.
Thank you so much. And in closing, thank you so much for letting me be a part of your panel this morning. I truly enjoyed each one of your presentations. Bahar?
Thank you so much, Lynn, and thank you, everyone. It was a pleasure to have this opportunity to talk to all of you. And, you know, just this being our last webinar, it was really an honor just to think how the knowledge in the field has translated into the change in the community, from water fluoridation to educational resources that have made changes in the community. Such a pleasure to be here. With this, I would like to thank you all for being in this journey with us in this webinar series. I would like to thank our sponsors and all of you for your flexibility to go through this with us, and all of you know, the feedback that we have got. We really appreciate all of that. Next slide, please. I'm quickly going to go through that, and I know Dr. Hill is going to do his own thank you as well. Just really want to thank everybody who has contributed to this, our planning committee, our moderators, and our presenters, and our sponsors. Really, everybody put their all of their efforts into changing what we plan to have in person into this series of webinars. Really, that naming some of the crew: Dr. Allukian, Dr. Fine, Drs. Kumars and Hill, Roland, UCSF Technical Assistance Center, Katie Conglin, you're amazing, thank you so much. Joanna from California Department of Public Health, and Maternal and Child Oral Health Resource Center, Katrina Holt and Sarah Colo behind the scene has made this happening. So thank you again. It has been such a pleasure. And with that, I will turn it to Dr. Hill to do the final thank you. Here's my contact information with any questions you might have. Thank you.
Thank you, Bahar. Just a few things to close things off. One is I want to thank all of the presenters today and in previous sessions, but particularly today. I want to thank all of you. I want to congratulate again all the awardees. I think I sort of sold, I didn't give enough credit, I think, to Dr. Rossetti and his award. And, you know, Myron Allukian mentioned that John Rossetti would always say that the stars are aligning, and I would tell John that the stars don't just align, that he was one of the primary people that kicked the stars into alignment, that made the stars align. It doesn't just happen. And my message to everyone out there is to remember that each one of us is one of those people that have to kick those stars into alignment. We're the ones that have to make things happen. The American Association for Community Dental Programs needs all of you. You know, I noticed that on some of the committees that were formed, the state dental directors were represented, but local dental directors weren't. And it's just a reminder again of why we have to keep ourselves out there to make sure that that we're involved in the planning and that our expertise is brought to the table. Next year's meeting, I want you all to take note of that right now and to mark it down. The National Oral Health Conference is scheduled to be in Orlando, April 19th to 21st. You know, at this point, who knows whether it'll really be there or not, but, you know, but we hope so. But our meeting, this meeting, which is every year we try to tailor this to the interest of folks specifically working at the community level. And so our meeting next year will be the day before, assuming that we're in Orlando, will be the day before the start of the Oral Health Conference. So that's Sunday, April 18th. I think it's at the DoubleTree at the entrance to Universal Studios. And with that, I hope that we'll hear from some of you who are interested in working with the Association of Community Dental Programs. Getting involved. There's plenty to do and plenty of leadership that we can have. Again, thank you so much to the Planning Committee. This was an absolutely incredible effort by these folks to put this meeting together. And so I can't thank you enough. Again, I want to thank all of you for being here, for joining us, and we'll see you next year. Thank you.
Thank you so much, Larry, and thank you, everyone.